It may not seem important now to take great strides in your health. You're strong and probably in the best shape of your life. However, this is the time when preventative medicine and checkups strengthen your foundation and prepare you for a healthy midlife. This segment of our preventative care series will outline the important medical testing and examinations from ages 20 to 40 that can lead to a much healthier future. Diagnostic testing, routine blood tests, and non-invasive procedures can help to determine many future health issues. Prevention is key to all stages of a healthy life cycle.
Hi, I'm Dr. Vasavada. My specialty is internal medicine. Typically, patients come to see me for adult medicine disorders like high blood pressure, high cholesterol, diabetes, headaches, back pain, neck pain, etc. Even if you feel perfectly fine, you may still have many medical problems. Some of them may not have any symptoms, such as high blood pressure, diabetes, high cholesterol, or even early stages of cancer, and you may not know about it. Therefore, it is important to have preventative medical checkups and testing to ensure that you are in good shape. You should have your blood pressure checked at least every 2 years. Current recommendations are that if you are less than 60 years of age and if you don't have other medical conditions, your blood pressure should be less than 140/90 millimeter of mercury. If you are more than 60 years of age, your blood pressure should be less than 150/90 millimeter of mercury. If you do have other medical conditions such as diabetes, kidney disease, heart disease, your recommendations may be different according to your healthcare provider's recommendations. Ideally, your blood pressure should be checked every 2 years. However, if you have other conditions, as I mentioned before, your blood pressure should be checked more frequently according to your healthcare provider's recommendations. High cholesterol can cause cardiovascular illness such as heart disease, stroke, etc. Your cholesterol should be checked if you are more than 20 years of age, at least every 5 years. If it is higher, then it should be checked more frequently. All adults above the age of 40 without any family history should be checked for diabetes every 3 years. Diabetes can cause multiple other medical problems, and incidence of diabetes in this country has been rising. Therefore, you should be checked on regular basis. It is also important to see your dentist at least every 6 months, since dental problems can be cause of some other medical problems, including heart problems. Those who have diabetes or hypertension should have their eye exams on regular basis with their eye doctors. After the age of 40, you should have your annual physical done with your primary care physician at least every 5 years. A lot of medical problems can be detected through annual medical physical examination, even if you don't have any symptoms. Adults should get immunization called Tdap, also called Adacel vaccination, which is combination of tetanus, pertussis, and diphtheria. This vaccination should be given to adults every 10 years. As a part of healthy lifestyle, you should also get influenza and pneumonia vaccinations. Influenza vaccination should be given during every influenza season. Pneumonia vaccination, which is also called Pneumovax, should be given after the age of 65 years. There are certain populations which are at high risk for pneumonia, should be given that vaccination earlier than that. Due to rise in the colon cancer deaths in this country, colon cancer screening is also important and should be done after the age of 50 years. If you have a family history of colon cancer or personal history of colon polyps, it can be done earlier based on your doctor's recommendations. Typically, colon cancer screening is done with colonoscopy. That means with a camera and endoscope, doctors look inside your colon that is currently considered to be the gold standard for colon cancer screening. As we talked about earlier, prevention of disease is way more important than treating a disease, specifically heart disease. Heart disease is taking so many lives in this country, and so much of these diseases are completely preventable, such as going to your doctor to get your blood pressure checked, going to your doctor for getting checked for diabetes, smoking cessation, weight reduction, keeping an eye on your BMI, that is body mass index, healthy diet, and regular exercise. These things prevent serious diseases like heart disease and diabetes in future.
As men, we tend to shy away from the routine physical examinations, especially when we just feel great. During a routine physical examination, some screenings are specific to men. These screenings are sometimes overlooked as they are, for some men, embarrassing to talk about. However, these preventative screenings can detect problems early, promoting a positive outcome and help ensure a long, healthy life. Recommended preventative tests for young men are testicular screenings. While the odds of developing testicular cancer are low because it accounts for only 1% of all cancers, it is the most common kind of cancer in men aged 15 to 35. Prostate screening. As the prostate is an internal organ, it is checked with a simple, digital, rectal exam. This exam should primarily be given at the age of 40, but if you experience any symptoms such as pain, difficulty urinating, swelling, or blood in your urine, you should have this exam done earlier.
Women usually care for everything first. Mothers put their kids and spouses first. Businesswomen put their careers first. And women in their 40s may be caring for elderly loved ones. As the old adage goes, if you don't take care of yourself, you won't be able to care for others. 2 preventative tests can save your life and only take a few minutes. Women in their 20s right through to their 40s are at risk for these treatable cancers. Early detection through regular preventative testing is key to a positive outcome. Do not put off your health, and see your physician as prescribed for these life-saving preventative screenings. Breast self-exam. A complete breast exam should be done by a healthcare provider every 3 years for women ages 20 to 40. Women should also do monthly breast self-exams in the comfort of their own home. You should contact your physician immediately if you notice a change in your breast, any irregularity, lump, hard spots, or pain. Pelvic exam and pap smear. Screening should start within 3 years after your first vaginal sexual intercourse or by age 21. Beginning at age 21, women should have a pelvic exam pap smear every 2 years to check for cervical cancer. If you are over age 30 and your pap smears have come back normal 3 times in a row, your healthcare provider may tell you that you only need a pap smear every 3 years. Be proactive so you can be healthier to take care of the ones you love. Many people today are confused about what safe sex and a healthy sex life is, and how to make wise choices about sex. Do not be embarrassed about talking to your physician about sex or sexual contact. We offer a comprehensive and understanding approach to adult sexual health and provide a full range of preventative options, and are here to answer any of your questions. A healthy sex life contributes to a healthy lifestyle. Transitioning from child to young adults, then on to adulthood, physical activity and healthy eating habits are very important to prevent many health problems that may arise. All adults benefit from physical activity. The activity does not have to be strenuous to be beneficial. Most adults benefit from a minimum of 3 20-minute walks per week. As we age into our 30s and 40s, adding strength training to preserve muscle mass is also important. Choosing a healthy lifestyle also means making healthy food choices. Lean protein, fruits and vegetables, and whole grains are among the healthiest of diets. We are what we eat by eating a high-fiber, low-fat diet with lean proteins and complex carbohydrates. This type of diet prevents many chronic diseases, diabetes, osteoporosis, and some cancers. In 2015, the Department of Health and Human Services and the USDA will publish a new dietary guideline. When we eat healthy and exercise regularly, we are protecting our health now and in the future. The medical middle of your life is your 20s to 40s. It is proven by medical experts that a healthy life starts as young as possible. Most test examinations and preventative measures are painless and only take a few minutes. Pronger Smith MedicalCare promotes the preventative approach for all of our patients. If you have not scheduled your yearly examination, have put off a recommended test, or just have questions about a healthy lifestyle for your age, schedule your appointment now. The decisions about your health you make today are the decisions that will ensure a healthier future. At Pronger Smith MedicalCare, we are fully prepared and equipped to provide you and your family with a lifetime of responsive and accessible care. Come in for a visit. We look forward to earning your trust. Thank you.